It's live.
Excellent. So can you guys hear me okay?
Yes, Balan.
Okay. Thank you so much, Ashish, for setting this up. A very warm evening, a good evening to everybody who's joining from India. A good morning to folks who are joining from other geographies. We are extremely delighted to have all of you over. So, my name is Balan Ramaswamy. I'm the CEO for New Vision. And like I said, I'm delighted to see so many of you joining us for this webinar. As you see, what we're going to talk about is connected healthcare. Now, I'm sure connected healthcare brings up different ideas in your head, right? So somebody's talking about telemedicine. Is this about doctors operating remotely? Is this about people with all kinds of medical devices all on them, right? Is this about payments gateway, right? So I'm sure there's a lot that these two words bring to your mind. Hold on, we will talk about it in detail. So we're going to do three things in this particular webinar, right? We're first going to talk about the opportunity that connected healthcare offers us, right? Then, like any opportunity, for any opportunity, we know there will be a set of challenges to actually implement it. So we will talk about that. And how do we implement it, right? Again, I don't want to have a lot of suspense. It will be by PEGA, right? By the solution PEGA, which we want to talk about to all of you, right? So that's the basic premise of this particular webinar. And like just looking at the audience, I'm very excited to see such a knowledgeable and a diverse audience joining us, right? So I hope we can keep you both interested and excited about the content. Firstly, let me start off by talking about the team that we have here today, right? I'm very fortunate to have some, esteemed colleagues of mine join me in this webinar. Firstly, Saurabh Joshi. Saurabh is our client services head. He's based out of North America. He's got over 25 years of experience in IT, playing various roles from a client, a partner kind of roles to solutioning and technology in his earlier days. He's also had, his experience as an entrepreneur. He's lived in multiple continents, and he considers himself blessed to be able to do that. Then we have Dave. Dave's our head for our BPM practice, and Dave brings with him over 15 years of experience in the BPM space, right? And especially PEGA in the last several years. We've got Swati with us. Now, Swati is our lead architect in the PEGA space with over 8 years of experience in this particular area, right? So let's get started, guys, right? To begin with, let me cue in Saurabh. Good morning, Saurabh. How are you?
Great, Balan. Thank you. And I would say I would have you talk about me pretty much every day. It makes me feel so great hearing you speak so many good words for me. So thank you for that. And I'm doing extremely well. And I'm excited as you are to be part of this initiative today. So let me begin by asking, how many of us would want to manage our well-being without setting foot in a doctor's office and not to be waiting to hear about our health till we go for an annual physical with our healthcare provider? Well, I would answer yes to that. And I believe that's right, Balan, that most of us would like that too. And we see all around us that there is an increasing usage of wearables and IoT devices, talking about what Balan mentioned about the connected healthcare. People are becoming very conscious about their lifestyle and their health. And people want to have health and clinical information anytime and anywhere. At least that's what they would want to. And they would like to have health and diet recommendation based on their lifestyle patterns. Everybody is unique, so everybody's situation and their solutions could be different. So while we have that need, businesses are already clued into it, and they are increasingly looking to understand how they can use wearables in their game plan.
Sure.
And they are going ahead and incorporating those. In fact, a study done by Salesforce, which is a leading CRM company, has reported that 86% of the businesses will increase their investment in wearables, and that is not surprising at all. If you see, we have some numbers up here. Gartner forecasts that in 2021, the global spending in wearables is going to increase at the rate of 18% to a big number of $81.5 billion. It's a substantial increase from $69 billion that was done in the year 2020. So there is a clear need in the market, which they are trying to address. So that's one side of the story. Moving on, if we look at the market opportunity, and that's where we at New Vision started to think as to what could be the work that we could do in this area. And here are the numbers that sort of give us that understanding. So just as a number, in 2017, more than 1 in 50 Americans who interacted with their healthcare provider, they had an excess of $5,000 in just out-of-pocket expenses. Wow. And as you may know, out-of-pocket expenses are over and above that one would be paying for their insurance. And 10,000 was the expense of 1 in 200. And if you start to look at these numbers, and we look at the other number that we have, we move on, 203 million Americans interacted in 2018. And these are 203 million adults with their healthcare professional. So if you bake in these two numbers and you do a quick back of the annual calculation, the numbers are quite stark. So if we see the amount of expense these 1 in 50 would have had amounts to about $20 billion just out of pocket. And then add to it the 1 in 200 who had an expense of $10,000, that totals to nearly $100 billion. Add them together, $120 billion was spent only in out-of-pocket expenses. So if I may have you to imagine, if we were to do a 1% reduction in these expenses, we are talking of hundreds of millions and possibly billions of dollars in reduction in the cost. And these are the costs that anybody would like to save. So what does that mean to us? This brings us to the segment and the opportunity that we are looking at. So just to give you all a perspective for those who would like to understand, there are 3 pillars of this healthcare. One being members. In the industry parlance, we call it members. This is nothing but common citizen, somebody who would be vested in their own interest, in their own health, and would be looking to understand what could be done to improve their healthcare. So we have certain areas that we feel do require improvement. Currently, we don't have. I'll just pick a few of those. Like for instance, for members, we would like to have proactive care. We don't want to be reactive when it comes to our healthcare. We want to be able to make sure that we know prior to knowing about a disease rather than later. So proactive healthcare services would be something that would be possible, or rather would be asked. Awareness about our health issues is again complementary to it, and be able to also understand what suits in terms of insurance plan that we could cut in and have curated for us. Moving on, similarly for the providers, these are the healthcare providers. They often don't get to see the patient's entire end-to-end visibility of their health records. Therefore, they aren't able to provide the prescribed treatment that would be most applicable to them. Same goes with payers who are the insurance. They at times don't have the end-to-end visibility. They aren't able to monitor in real time. So looking at all of this, if we move and to see what is the opportunity here. So clearly 2 segments come right out to us where we are able to address. One, increase these services that are able to be rendered to the members that the healthcare providers can provide and which can be insured by the insurers, while doing it at a lower cost. Everybody wants to do it at a lower cost. And there is an ample opportunity for us to reduce those costs because of the sheer size of the numbers that we are talking about. So this is where we are going. And that is what we are trying to put together as part of our solution, the area that certainly would be required for somebody to address. And there comes in our team with the solution that we have put together, which we are going to be talking in detail.
Perfect, perfect. So it does seem to be a very big opportunity, right? The numbers that you were throwing out there, right? Again, billions. is a significant opportunity. But when I was looking at it personally, right, with all my Apple watches or my Fitbit devices or the Garmin devices, the glucose meters, what you're saying is there's so much of information coming in, right? So at one side, all this information is starting to go up, but the costs are also going to go up. So you're looking at a great opportunity where if you can merge both of these together, you can actually bring the cost down. Did I get that right, Swarup?
Absolutely. And in fact, this is something that would be of interest for all and everyone. And there are levers that we could control and make a dent, if you will, while we would wish to reduce it to the minimum, but at least a dent, given the size of the numbers that are there, there is enough for us to derive a benefit out.
Perfect, perfect. So let me cue in Dave here, right? So Dave, you clearly heard the opportunity that Saurabh is putting out there, and as a technologist, I'm sure you're already starting to think about what are these solution components, right? What do you need to pull it in together? So at a high level, right? Can you start to talk us through what will it take to build a solution of this sort? Dave, you're on mute. Technology's not got to that point where.
Thanks for nice introduction, Balan, and
Sure.
good evening to everyone. And Balan, that's the most difficult slide you have given to me. So I'll try to explain. So overall, I see there are 6 components we would be using to provide this end-to-end customer journey. So when I say journey, means customer has requested an information and then we give the right recommendation to the customer. So I will come to that each and every component there. So we have given a cloud information, right? So the cloud, we need to have a store a different type of data. So as we are aware of that, right? So we need to connect it with the provided data. That is the first and foremost things we need to have this integrated, right? And then you have to other database information. Let's say where you have a regulatory authority, these clinical guidelines which are being stored, right? So these data also should come, right? If you see these wearable devices and mobile apps, right? And I am very sure everyone we are using that the Samsung Health app or any other health app, right? Which
Sure.
tracks your steps, which tracks your calories to be burnt. So these real-time data, right, will be coming through an IoT hub. So we need an IoT hub which will take all your wearables data as well as from the mobile apps. Now we also have a social networking channel. So how these social networking channels come to a picture? Let's say you are not feeling well, Balan, and you wanted to contact your primary health center, right? And you just type it that I'm not feeling well, I have a breathing problem, right? So these data, right, along with your wearable devices, your pulse rate, heart rate, right, it will combine, right? And then the data analytics, right, our 6th component, the data analytics come to a picture. It analyzes data and it gives you the best recommendations. And don't forget that it is not only for members. So we are focusing with the connected healthcare. So the recommendation would be for the members, but also for payers and providers. So when you reach out to your provider saying that you have a breathing difficulties, right? Provider also gets all your case history, all your family history. If you serve with this provider earlier, what are the treatment plan that provider has given you? Everything he has there in the fingerprints, right? And he can give you the more other recommendation which application is giving you. So application have lot more of data, and then based on that application can decide which would the best action you can take, right? Even if you need an admission, you can just book an admission, you can claim authorizations, you admitted in hospital, you get a treatment, upload the treatment plan, and then
Sure.
the discharge, right? So these are the area point we are focusing, and these are the pillars. These are the 4 pillars we have to mention. So first thing, we need to have to upload the provider data, clinical data, right? The history data, right? And then we need to have an IoT hub, which will take a real time data from a mobile app. And then we need to have a data analytics tool, which will create a model, which will give you the predictive and analytic data analysis, and then the next best recommendation.
Sure, sure. So this is very helpful, Dave. So at least what you have done is you've given us a framework through which we can think about this opportunity. So you listed out 4 basic pillars that you need for building a solution. I'm sure it is not as easy as this diagram, but like they say, all perfect things are actually simple. So from a simplicity perspective, I think I've got a good sense of what it will take. Now, from a actual implementation, I'm sure it's not so easy, right? Any opportunity, any story that has a huge opportunity typically comes with huge challenges as well. So why don't you tell us what these challenges could look like, right? So when you're actually trying to build it, what does it look like?
Definitely, it's a huge challenge. You can see the icon in the presentation, which gives you that idea, right? So in that market, in the current market, right? If we take the leaders and the options, right? We can have AWS, we can have an option called Azure, we can option for Google. So which all of them three has an IoT hub concept. They can give you that data analytics, right? And they can have a cloud choice. So these three components which we discuss, all these three will get it, right? And then you also have a BPM workflow tool, because we don't wanted to only provide a message to a customer. We wanted to achieve the end-to-end connected healthcare from a patient are requiring some help till you get admitted and discharged, right? So you need lot of process on that, right? So to enable this process and including this next best action with a data analytics, you obviously need a BPM tool as well, which gives, it delivers the message to the customer. And all these, if you see this, the integrated system, right? Again, you need to have a provider data, you need to have a legacy data, you need to have a cloud. So these are the different type of integration you need to do, have a different type of data access, and make this data as an input of your analytics.
Sure, sure. So what you're saying is there are options available out there where you could pick up all these different set of technologies and
Right.
actually build a solution, but you're seeing challenges in those.
Right. The challenges would be, the see, one means an organization, right? There are different of process, different of system which are built a decade ago, right? And these systems are built for a specific purpose, not for a customer journey. So what happens is, when we need to integrate the data, these data are distributed in a different system in a different format, and you need to integrate data and mining data into the common format, correct? So that is the challenge. And what happens is, when you use a different platform, right, technologies, if if some of the platform has been upgraded, you need to analyze whether other platform is supported or not. If not, you have to also bear the cost to upgrade your other platform to make your business process works. And because of your silo process or silo system in built on the app and your enterprises, what happens is you hardly have a reusable assets. So you will see the all the repeatable data which are there in every system. So through the data access, you need to filter out this repetitive data and conclude with the exact data which actually you need to deliver the message. So these are the challenges.
Sure. So what is the answer then, right? So clearly this is something that we want to implement, right? What would you recommend?
Exactly. So what happens is, we also have a PEGA, right? PEGA is as a BPM tool, BRE tool as well, but PEGA is a single platform where we have customer decisioning hub, we have a automation intelligence, right? We have a RPA, we have a cloud choice. So it's a single platform where you can get all your required components which we have shown earlier, So, and that is why I recommended PEGA, and PEGA also have a seamless uh, connectivity. If we have even IoT hub, which is already implemented in some of the enterprise, PEGA can be able to connect seamlessly to that and get the data. So that is the reason my recommendation is to give to PEGA, right? Also, if you think of the solution perspective when the actual product will be built, right? Think of that million of customer, maybe million of customer will be using that, and then if every customer will be giving that diet recommendation, medicine recommendation, these 4 times of a recommendation in a day, it will reach maybe a billion next best action, right? And even we have done some research on that US healthcare. So US have more than 110 diseases has recorded, right? The treatment plan has been recorded. 10 types of disorder, right? So every disorder has a different treatment plan, Medicare plan. So based on that, you have to also present the next best recommendation to the customer, right? And to the channel, right? PEGA also has an omni-channel capabilities. That means PEGA can deliver a contextual and consistent message across all channel, and it is as per customer preference. So it's a part of industry preference, right? You can choose whatever you want, right? And for a data perspective, if you think of that, if you have a medicine, medical data, treatment plan, diet data, you have a huge data. So I assume maybe it's 150 billion data attribute point we have to use within this next best action.
Sure, sure. No, this is interesting. So, when I heard Saurabh talking about billions, I could see dollars, right? And that was the opportunity which is there. Now you are moving it to the technology challenges, and you're telling us even for, let's say, if you were to look at 1 million customers, right, which again is huge, you're talking about 1 billion, best next action decisions that needs to be made, right? So we're talking about significant data here. We're talking about significant compute, and we're talking about significant analytics here that needs to kick in. So I think you've got us excited around this, Dev. Now let's get into the meat of the solution now, right? I'm sure you've thought through that. So between you and Swati, can you now start talking about the actual solution and how does the platform look like?
Yeah, I'll introduce Swati. Swati is our lead architect, so she can explain that why we are preferring the PEGA customer decisioning hub, and what we have done is we have mapped a customer journey end to end, right? And we mapped it in an actual presentation how a patient need a help, right? And this solution, how this solution give the patient with the next best recommendation. So I will hand over to Swati. Let her explain that.
Thanks, Deva. So as Deva said, right, we actually prefer PEGA to address this particular issue. Now let us see how PEGA Customer Decision Hub is used to solve this problem. First, let us understand what Customer Decision Hub is. So Customer Decision Hub is a solution that combines the data management, the decision management, and the advanced analytics and provide a solution to the customer. Okay, so this Customer Decision Hub is fully integrated with PEGA platform so that it provides the appropriate solution to the customer. We have actually divided, for our purpose, we have divided this Customer Decision Hub into 6 stages. Let me go through each of this stage to give you a better understanding of what is done in each stage. Going to the data, first is the data. Okay, so data is the driving factor, and as Deba said, data is huge, and this is the most critical element that is used for the next best action to work. If you see this diagram under data, we say that data can be stored in multiple ways in a given organization, right? So this data can be saved in a local database, it can be in your legacy applications or in cloud. Now, why we prefer PEGA here for this data is PEGA has a concept called live data. What is live data? So live data is like a virtual abstraction layer that is used as a common platform where you can integrate all different data sources like your cloud, your legacy applications, everything. What this live data does is it uses this data as a business objects for your customers, transactions, your history, all this, right? It uses them as a business objects. And that is how we actually integrate this data from multiple sources. We need not get into one place at all. So this data, this live data will be as a single source of truth. Okay. Now, once all the data is collected, the second stage comes the insight. So we have to perform analysis on that huge data, whatever comes in. So here in the insight stage, it would be either adaptive and predictive model that we prefer. Okay. Also, PEGA allows SaaS models also, which means you can actually have your own models developed in any other technologies. Just import it and you can use that model. So in your legacy application, if you already have some models defined, we can just import it directly and we need not create that model from the scratch. Okay. So once the analysis is done, you have data, you got analysis. Now is the strategy. What this strategy actually understands the business goals and derive what solution or what recommendation should be given to each work party. So as we started earlier, right, it's a connected healthcare. So our work parties here are the members, the customers, the providers, the doctors, and the payers, who actually is the insurance company. So our solution should be benefited for all these work parties. If I can say, the strategy can be built for different types of people, like sales strategy. For example, suppose you have a customer. Okay. Now, as part of the payers, he should decide, we can actually give him a recommendation as to what plan can he give a particular customer, so that he or she, the customized plan for a customer, so that he or she is willing to take that. And also we can have a retention strategies, like if a customer is not happy or if you want the customer to stay, what are the retention strategies that you can apply, which the payers can do. And also we can provide services such as proactive services or a medical plan that is actually available for useful for both the members and the providers. That way strategy phase comes in. Okay. Now moving on to the deployment. When we have the data, we have analyzed it, we have already applied strategies. Obviously, this application should be deployed somewhere, right? So either it can be deployed on cloud or on premise. PEGA provides both these. Okay. And PEGA has its own cloud as well. And also it supports AWS, Azure, and Google. So you can actually deploy this particular application in any of the form that you want. And in deployment, again, you see a small thing called data flow. So now what is this data flow? It is actually for the business people to assess the performance. Because we have created model, we cannot directly go ahead and use it, right? We have to assess the performance of that model, how it works, who has benefited out of it. So all this is done in the data flow. Now comes in the delivery. Once the strategy is made, in the strategy, the recommendations have been received, right? We have to deliver it to our end customer. So all the parties that are involved in this may have different preferences through the mode in which they want to get it delivered, correct? So this delivery will be an omni-channel delivery, like the same message, same recommendation can be delivered across all channels. You need not have multiple ways of delivering our messages. Okay. And control is basically the best part, where it is like a dashboard. It gives you a complete sense of what is happening for the payers and the providers. It gives a complete sense of the business, about their models, which model is good, which is being used by the customer, which plan is having a great customer rate. And also for the members, this control will give them a complete picture of their treatment plan, their customer history, their medical data, all this. So likewise, from the data till the control, all the work parties involved have a complete understanding of what is going on, and they have a complete control over this particular solution.
Great, great.
Yeah. So Balan, I just wanted to add a point here, and I think it's a very unique proposition which PEGA gives, and that's why I for PEGA. It's a live data. The concept of the live data is, normally what happens is the data access happens through a procedural way. So whenever you require, you write a joins, you create a views, you write a queries to get the data as when it is required, right? And think of that if it's a repetitive data in a multiple distributed system, how long it will take to actually filter out the exact data which you need, right? And the benefit of PEGA doesn't do this way. So live concept data is you create an object like a customer, right? And the back end that is mapped to a many different systems. It can be a cloud, it can be a other database, it can be a legacy system, right? Who is the data analytics or a data designer who is actually creating the models? He doesn't have to worry about that. He has to only use the customer object that gives the entire data, right? That is the beauty. That's what I prefer to use today.
So from an implementation perspective, right, the way Swati kind of laid it out, I'm assuming when it comes to strategy, we don't need technologists like you driving the strategy, right? The business can get in and then they can start picking up strategy. So PEGA is intuitive and easy to use enough that the strategy actually business can get in.
Exactly.
Yes.
That is the purpose.
Perfect. So I think this is a very good mental model that you guys have given us, right? Right from data to the actual control. And by control, I'm assuming what it does is it not only understands the analytics that is coming, it also helps you tweak things, right? So you can tweak a few things here and there based on how you want to take messaging back to the thing. You can tweak your models. You can do all of that.
Exactly.
So let's bring it back to the real world, right? How does this really look from a real world and from a customer experience perspective?
Right. This is the customer journey, and let Swati will explain that we try to map from a customer requested some help and then what customer has been getting delivered. Yeah.
So the previous slide actually had a huge amount of data. I know it would have created many questions. So let us take it with an example. Okay. So here, if you see, let the example be me. Okay. So I have a sudden raise in my blood pressure. Imagine I am the customer, I am the patient, and I have a sudden raise in blood pressure. So what I will do, I will chat through the app, I will chat to my provider saying that there is a sudden increase in blood pressure. Now, once this message is received, what happens is all my data, like I might have a previous history, right? So all my previous history of the customer is being taken from the cloud. So if you see, I have a previous history, medical history of weakness and also a loss of appetite. So this particular data is stored in the cloud. Okay. Because I have all this medical history, obviously I would have gone to a provider to get some medication. So the medical plan that the provider has given me, the provider details, and also the case history, all this also should be somewhere in the database. So it depends on the organization, the provider's organization to which I have gone to, the way they want to store their data. It can be a local database or a cloud or whatsoever. Okay. And then because I have gone to a provider, I have taken a treatment, obviously there will be a financials that gets involved in it. Okay. So there will be an insurance, there will be an insurance, obviously. So there's a benefit plan, there's a co-payment that I might have done. So all this data related to the payers are also there somewhere in the database or your legacy application. So now if you see, the data is spread across multiple sources, right? Also, I am wearing a smartwatch. Okay. So all my oxygen levels, the sleep, my sleep analysis, my blood pressure rate, heart pressure rate are all being tagged in the IoT. So on IoT, all this data is already there. So what happens when the provider receives this particular information is all my data is collected. This data is being analyzed. In the insight stage, actually, the predictive and adaptive analysis model take place. Okay. And there is an analysis done on the data based on my previous history, based on the current situation I am in, and based on the medicines that I have already used. So all this, there is an analysis done. And a next best action, the recommendation has been provided. So if you see in the strategy stage, right, there is a recommendation that provider asks me to have an alternate medication just to see if my blood pressure reduces. Okay. And then he also provides me with a diet recommendation, maybe because of diet or something that my blood pressure has gone up, and some activities which can actually be helpful for me. In the same way, there's another work party, the provider also, right? Because he has provided me with some information. So he should have a treatment plan that he has provided. Also, he should also have a note of the recommendation medicine. Correct. So even this particular strategy is being provided by the application, which says, okay, for this type of person or for this particular disease, you can actually recommend this medicine. And this is already noted down. Okay. And also there might be a chance that the customers, like my insurance is getting ended, or I might need a new insurance, a customized insurance, right? So recommendation is even sent out to the payers saying, like you can actually get a customized plan for this customer because she has already had this medical history. So there is 10% chances that she might take this. So all the work parties involved here are getting the best recommendations that they can do, and all this data is obviously saved somewhere. Okay. So now once the strategy is done and the particular, like I am using the application, I will get the message. And if you see in the data, right, we are even collecting a preference mode of communication through the application, which means every work party that is involved will have different preference mode. Of course, because as a customer, I would not think that I have to go and open a mail to check what is the recommendation that my provider is providing, right? So maybe I have an in-app particular preference, and for the provider, he might have a different preference to maintain his clinical records. He might have a different preference. So across any channel, the recommendation for that particular work party will be delivered. And this is how I, as a end user, who I am suffering with a sudden increase in my blood pressure, got the best solution. And also there is a control where if something goes wrong, God forbidden, nothing should happen, but if something goes wrong, then every person involved in that particular work party should be notified. And also there is like the next possible ways, whatever happens, the next solution, that is also being taken care of.
Perfect.
So this is how the data flows in.
No, I think that's great, right? So I think what you're really showing us here, Swati, is how this will happen in the real world. And in fact, one of the things that I like best is in the strategy, you actually pull it out into 3 parts. So you're looking at it from the payer perspective, right? The insurance company perspective, the provider, and from the member perspective, right? And it's not a zero-sum game. In the end, all 3 parties can benefit from a technology solution, and they can help reduce cost, and they can, increase the set of services that they get, right? So I think this is very interesting. But obviously, implementing this needs a plan of its own, right? So concepts also need to be implemented. So Dave, why don't you talk us through how the entire implementation will happen? Dave, you're on mute.
Sorry, Bala. It has to be followed by phase, right? The first phase, as we said, we need a member's clinical information, medical history, family history, and allergies, right? We need an IoT hub, which will take my real-time data from my wearables and a mobile apps, right? We need to have an option for, providing this service to a new members and providers who wanted to enroll these services. And this outbound marketing, it's a recommendation. So for each and every party should get the relevant recommendations, right, for next best actions. And for phase 2, right, what we wanted to achieve to the alternate medicines. So every medicine has a side effect. All these segment of people cannot take a same type of medicine, even though their problem is the same, right? So that is what we wanted to upload all these medicine compositions, liabilities, side effects, and treatment plan based on the segment of a customer. What treatment actually gives you the most highest success rate or a medicine effectiveness rate, right? And then phase 3, we can also integrate, because we are using PEGA, right? We can also integrate PEGA care management framework, which is more aligned to an US healthcare, but it has a certain benefits on that. It has a disease management, care management. It has already an integration with the clinical guidelines of US, right? So you get a lot of data from there as well, right? It has your claims process, authorization process, appeals and grievances. So there are a lot of more things you can do it in using this framework. And
Sure.
also you can use it to the pharma sectors for a success rate or a effectiveness for a certain medicine. And like cancer I have given, so cancer has a lot of different type of cancer, different type of stages of cancer. Every stages has a different treatment plan, maybe different medicines, right? So you can have a track on that, and if some patients can come, the next best recommendation without any thought, right? Like medical board, right? That's the same thing which actually this decision engine will gives you. So collecting on all data and gives you the right treatment plan for this particular patient. That is what we wanted to build.
No, this is useful, right? Because we all know, right? People who have implemented programs in the real world know that you can't just take a big piece of work and say, I'm going to deliver everything, right? So an iterative incremental model is what has worked for all of us, especially in large transformational programs, right? And I would clearly call this out as a transformational program, right? So I love the way that you've broken it down in steps, right? So you're saying, hey, these are the bare essentials. You can do it step by step. And again, I'm assuming everything doesn't need to be done on the platform. I heard Swati talk about a lot of integration that you can do. One of the points that she called out was the analytical models also is a SaaS-based model, right? So if there's somebody who's already got an analytical model, you can kind of weave it in. So this is very useful. So let me try to sum this whole thing up, right? Because you guys have given us a wonderful story now, right, of how this whole thing is going to play out. And in fact, this reminds me of a movie called Elysium, right? And in that movie, if I remember right, in 2154, there is a state in which people are just staying at home. They don't have to go to the hospital. There are medical bays at home itself, right, where you get treated because all the information is flowing so freely between all these partners. And to just reflect on the last 12 months, most of us have been working from home, and getting into hospitals has been difficult, right? So I'm so happy that you're bringing a story which was there for 2154 right now. So what you've showed us is that there's a significant opportunity out there, right, where a connected healthcare can bring down costs for the member, whereas you can significantly improve the experience of the care. And this is about truly caring, right? So this is obviously there's a business angle to it, but you're also showing that this is caring for the health of the population, which is like the core of this entire solution that you've set, right? And then, I know Dev and Swati will be very upset if I don't call out PEGA. So, and you've truly advocated why PEGA is the right platform to implement this, right? So thank you so much, Dev and Swati. Now, I'm sure one question will be, why is New Vision doing this webinar? What are your credentials, right? So let me pull in Saurabh again. Saurabh, if you want to talk about why New Vision? You're on mute, Saurabh.
My apologies. All right. Yeah. So certainly we would be quite keen to be part of this journey. While we've advocated PEGA to be the solution, we certainly have an interest in saying why New Vision would be one of the partners to do this. And we don't speak because we feel that we are able to. It's our experience and our credibility that we've built in the market over the past 17 years that we've been in the business. We've scaled up to be about 300 odd employees, work out of 6 locations. And certainly specific to the PEGA, we have what we've built in terms of expertise. We have a PEGA COE. which is essentially working to create proof of concepts, bring out solutions like this, take them to the market. We've also been able to have recognition from PEGA itself. We are a recognized PEGA partner. And then looking at the two elements that are comprising of this solution, experience in the IoT, we've developed and implemented many projects around IoT to multiple clients. And we have PEGA that we've implemented, one of our top marquee clients, which is a Fortune 50 client, that we've used PEGA. We've done a BRE implementation, which is the business rules engine implementation with end-to-end case management. All of this brings along our stake on this solution. And we also have a strong leadership team, a leadership team which is just not executive managers, we have practicing managers. They are part and parcel of each of the solutioning and delivery, and bring in the technology expertise and the domain experience across various industries. And there is a mantra that we kind of live with, that we are small enough to care for each customer, but big enough to be daring. So small to care, big enough to be dare. And that's where we sort of live with that mantra, and repeat customers and clients sort of give us that confidence that yes, whatever we are doing it right. So that's where I would sort of like to summarize why New Vision would be an ideal partner in this.
Perfect, perfect. So thank you, Saurabh. So I know we started a little late, so we'll open it up for questions now. I had a few questions which had already come to me, so maybe we'll start with that, and then I'll also take up the questions that came up on the board, right? And we'll still try to wrap it up on the right time. Folks who have more questions, happy for you to stay back and get your questions answered, right? So the first question I had was, clearly around security. So Dev and Swati, two questions, right? When it comes to security. First, you're talking about significant amount of PHI here. So what are your thoughts on security of the data?
So Balan, when you say the security for the cloud, right? So normally what happens is it is more about a compliance. So every regulatory body or every country has a specific compliance for that healthcare data, right? How it can be kept. So in US, right, they use a HIPAA compliant data, right? And I know there is a cloud options called a Philips Health Suite platform, right? Which is compliant, which can be integrated with Pega, right? And how that platform works is it actually that it encrypt the data. So during transformation from your wearable device or the mobile app to the cloud, right? So the downwards and upward, right? Both directions actually encrypt the data, and the receiving participant will retrieve the data and use that whatever is required. But in the cloud there will be many other security, right, which can use as to protect the data, but mostly it is driven by a government laws or compliance.
Sure, sure. Now, a very related question will be, we spoke about, and this is the question that's coming from the audience, where we're talking about medicine recommendations, right? And the example that you took, Swati, or that Swati was talking about, is in the end you're also saying that there will be medical recommendations being done by the platform. Now, I wanted to clarify here, right? And just tell me if it is wrong. This is where, again, PEGA, the beauty of PEGA comes in. Recommendations are not just directly sent to the customer, right? Because there is a BPM tool in the middle, you can set a process where it goes to the provider, and only if they approve can it go there. Is that understanding correct?
Yeah.
Yes,
So
Balan.
even in the telemedicine, right? If you see the common health issues, right, cough, right, it was not always the doctor said. It can be through the bot. Okay. So the telemedicine not always driven by a doctor. So this depends on again your medical guidelines. So India, let's say ICMR. ICMR has a specific guidelines how to treat that specific condition, right? In US also it has a guideline, right? Heart corporations. So it gives the guideline. So based on guidelines, you can define your process. So it is not always you send the medicine directly to the customer, right?
Sure, sure. So I think it's a very valid question, because when we say medicine recommendation, right, it just talks about things. So I think it's a very good question. I think what we want to emphasize is the platform has the capabilities to deliver that. Clearly, you will have to acknowledge the the regulation in the geography and see whether it can be sent directly or it has to be sent via a provider. If it's via a provider, you can really put in a lot of process management, right, using PEGA, through which it goes to the right thing.
Exactly.
The other question I had was about scale, and I know we're running out of time, so just short answers, please. You mentioned large numbers. Does PEGA have the capability to manage the scale?
Yeah, so it's not about PEGA, Balan. So it is about the entire platform. If you see the scalability, right? It also comes from the cloud. So cloud also has to be scalable, consistent, and reliable, right? Including the PEGA platform.
Sure.
And for PEGA, right? PEGA has a capability to deliver a million of next best action the day in a day, right? And it can has a thousand of models can be decided, and it can work seamlessly.
Sure. So again, a little different question, and maybe for Saurabh. Saurabh, the question is clearly this kind of a solution not only is related to healthcare and IoT, which you spoke about, but there will also be a lot of integration to payment gateways, financial institutions, right? Because healthcare is now spreading. It's not just a prerogative of a payer. So what is New Vision's experience in BFSI, right? Do you have the experience to also look at an integrated solution across these different disciplines?
Absolutely. We do. We have been interacting and working in those industries. So we've garnered those experiences in working with multiple providers, be Stripe or PayPal kind of payment providers. So yes, given the kind of world that we live in today, integrating such solutions are not just left to the BFSI industry, so to say, in the old world as it would have been. Everybody is sort of getting online. So the need for bringing in these experiences may not just be limited to those industries. So yes, that experience does exist.
So, perfect, right? And just to add on New Vision's credentials, in fact, with a partner company of ours, we have a full-blown fintech product, right? Which helps you get credit on tap, right? So significant exposure to payments and to BFSI. And again, for the person who asked the question, happy to engage offline. So guys, I'm conscious of time and I want to be respectful of everybody's time. What we will do is we will send across to everybody who joined, right, a link to this recording at a later stage, but also a contact information through which you can connect with us, right, and take this conversation forward. Thank you so much, Saurabh, Dev, and Swati for taking the time and effort to put this wonderful, thought leadership with this audience. I personally learned a lot, right? So it's been exciting. And for everybody from the audience who's taken the time and effort to join, and everybody who's contributed to questions, thank you. We can keep the conversation on. Please stay connected to us. Thank you.
Thank you.
Thanks, Valerie.